Hey, today we're going to be talking about 3PD and visual dependence. My name is Dr. Madison Oak. I'm a vestibular physical therapist. I'm here to help you with all things dizziness and vertigo. And with me, I have Dr. Drew.Aligns.
What's going on? Yeah. So I really specialize in helping people with cervicogenic dizziness and also PPPD. And we'll get into why those two things are so related. But the reason that we wanted to make this is because it's extremely common and something that is pretty simple to understand when it's explained to you correctly, but is very misunderstood. And it is a little bit confusing when you're trying to Google stuff and figure it out on your own. So we just want to take some time and try to clarify it and hopefully give you a better understanding of it and a good idea on how you could fix it. So yeah, I think we want to talk first about, what is it and how does it happen?
Totally. So, Drew, could you tell us kind of about visual dependence and visual sensitivity? And we're not talking necessarily light sensitive today, but why are people so sensitive to being in the grocery store, Target, other places, driving? Like, why is that so irritating and why is it related to 3PD?
Yeah. And so I think we both posted content about like grocery store dizziness. I certainly had it myself and like it resonates with people. It is one of the most common things. Like why is it so difficult to go into a grocery store when you're dizzy? Well, typically the best way to think about a grocery store is it's a hyper busy visual situation. There's lots of people, there's lots of color. And so basically if you think about visual dependence, which we'll get into how exactly it happens, but what that means is that instead of using all your balance systems, your vision, your inner ear and your neck or proprioception, you're dependent visually. That can be all right if you're at home and it's chill and it's natural lighting. But if you go into a hyper busy area, like a Walmart, a Target, a concert, restaurant, it's too much for your eyeballs to do alone. And so that dependence can lead to sensitivity, right? Because if you need to use your eyeballs for everything and then you go into an environment that's super stressful for them, it can overwhelm you and cause symptoms in an invasive way.
Absolutely. I mean, you're supposed to use all of your senses, right, for all of the things that you do day to day. But if your vestibular system kind of goes offline a little bit and you start not processing those symptoms the same way, whether it is a central vestibular disorder, a peripheral issue that you're dealing with, the same two things can apply. And it's important for us to be able to reintegrate those as physical therapists to help you kind of be able to better understand and comprehend the things that are going around in your space so that you're not so dependent on your visual system, which makes you hypersensitive.
Yeah. And that's what I was going to kind of ask you about is like, well, how is it related to PPPD? How's it fit in the dizzy cycle? But mainly the first question is, I think you touched on it. How is it secondary to, it can be secondary to a multitude of original causes or initial causes. How is that? Can you talk about how visual dependence or sensitivity is related to PPPD and how it's kind of secondary to different things?
So 3PD is a central vestibular disorder, meaning that there's nothing wrong with your vestibular system necessarily on the peripheral portion of it, meaning the actual inner ear itself. And for some people, the underlying cause can be a neuritis, in which case, yes, something will be wrong with your inner ear or Meniere's disease, something like that. But for a lot of people, there's nothing wrong with their inner ear. You're just having a processing issue. And when you start having this processing type issue, 3PD, your brain actually changes. We can see on certain types of scans that your brain starts to truly change the way it processes information by upregulating the amount of information coming from your inner ear and by upregulating the amount of information coming from your eyes and downregulating the amount coming from your inner ear and proprioception. And so those parts of your brain literally get smaller. There are fewer neurons to help you do that and more neurons to help you process visually. And so literally 3PD, although it is technically in your head because it is located there, it is a physiologic brain change that is happening, and we need to physiologically change your brain back, which a lot of that is getting comfortable being really uncomfortable in different situations and learning how to breathe and ground and kind of lessen or lower that anxiety that comes with the 3PD, because most people, not all people, but most people with 3PD do have some level of anxiety that's contributing to that, but also it's contributing to your anxiety because dizziness and anxiety are processed in the same, if similar, if not the same places. And we talk about the dizzy, anxious, dizzy cycle, I think a lot of people are like, well, I'm dizzy and I'm anxious, but like anxiety is a biological process. It is a part of our body, and we need to stop separating mental health from physical health. And these two things really do run into each other in sometimes a really good way and sometimes a really bad way. And so differentiating between these two and also making them one in the same and saying we need to manage both of these things because your mental health is part of the biopsychosocial model that we should be leveraging on healthcare, or leveraging for our healthcare, is what causes and also what treats triple PD.
Yeah, 100%. And like we were talking about before the call, it's just helpful to kind of realize like everybody has anxiety about their health at times. That
Totally.
is normal. And like whether it's dizziness or pain or anything, like when you are stressed or you're not sleeping well, it will make everything worse. And that's just like you said, that's just part of our natural physiology and anatomy. So I think that's helpful to recognize like it's normal to be anxious about not feeling well. And it's very helpful to treat it. Well, I kind of jumped again because I was going to ask you about like how it initially happens in your experience. Like certainly we've both treated a lot of people dealing with this. But I think you mentioned a few initial causes, but yeah, like in your experience, how do people get visually dependent or visually sensitive? Like what is leading up to that?
So a lot of things can cause 3PD, and persistent postural perceptual dizziness is a secondary condition. It does not just come out of the blue. And I think this is a really common misconception, even from healthcare providers. But if you read the diagnostic criteria, 3C, I believe, says it must come from an underlying medical, neurological, vestibular, or other disorder or issue. So it can come from chronic anxiety and panic attacks, but I find that's really, really, really uncommon in comparison to the people who get this from vestibular disorders. So if your doctor's like, well, you're just anxious and panicked, that's why you're dizzy. Yes, that definitely has something to do with it, like the anxiety that comes with dizziness. But 99% of the time, it's probably not actually the statistic. It's probably more around 90-ish. That group of people is having a vestibular disorder. And sometimes it's central and sometimes it's peripheral. And what this means as a peripheral vestibular disorder means you have something wrong with your vestibular system. So that can be something like Meniere's disease. Sometimes a concussion can be peripheral. Sometimes a vestibular neuritis or labyrinthitis, something like that, is a peripheral vestibular disorder, which is no longer sending the right vestibular signals to your brain. And so then the dizzy, anxious, dizzy cycle will start, the 3PD cycle will start, and getting a handle on that when you first start with dizziness is really important to avoid triple PD. Other reasons you can get it is from a central vestibular disorder, right? You can get something a problem processing vestibular input. So maybe you're having trouble processing because of a concussion. Maybe you're having trouble processing because of vestibular migraine. There are so many different reasons that you can have a central issue where you're no longer processing the correct stimuli that's coming from your vestibular system. And that can also lead to triple PD. And remembering again that, yes, there are lots of different reasons that this can happen, but it's usually not just panic and anxiety. It can happen. I've seen it happen, but typically it's a vestibular disorder that's causing this.
Yeah. And I think like that is a crucial point to understand. And like you said at first, just emphasize this. I think it helps people conceptualize this. It's always going to be secondary to something. And the reason it happens really is because some issue occurs where one of your balance systems or your central processing is not working right. And so your brain starts to try to adapt and help you. But in that adaptation, it can lead to issues, right? Because it was designed to work in a certain way. And if it's forced to change, there's going to be certain issues that arise. And in the simplest sense, that is kind of what's happening, which is helpful to understand, like you said.
Totally. And is it just like one thing? You're like, oh, you just get dizzy one time, or I shouldn't say just, but just as in one time, get dizzy one time and then you end up with 3PD always, or is it more of an amalgamation or conglomeration of things?
Yeah, I would say typically what I see is like there's an acute onset event, and then which we're going to talk about in a case example. So like you said, like a vestibular neuritis, you're severely dizzy for like 4 or 5 days, and then it'll go away and people are like, oh, I feel pretty good. They go back out, but they realize that some things have changed in their body in that period of time when they were sick, and it can kind of progress over the course of months. So it's usually, I think PPPD almost always is a slow progression into it.
Absolutely.
Yeah.
Okay, so what are the main issues with how it's treated? So I know there's a lot of people who are like, well, I've had 3PD for years. And someone asked me the other day, like, how long does it take 3PD to go away? I hear in 7 years it always goes away. And it's like, probably not. It's possible for the 3PD symptoms to kind of subside, but what does that look like?
Yeah. And I think honestly, like when I reached out to you, the biggest reason I wanted to do this was mainly to talk about like what are the main issues with how it's treated. Cause I think we both see people get the wrong advice or find the wrong advice online. And it can make it much worse and honestly make it take a long time to get better if you're doing the wrong thing all the time. So yeah, basically the main issue, if you think from what I see, is if you think about it as PPPD is secondary to something, if you don't treat that original thing, like if you have a vestibular neuritis and your vestibular system isn't working well, if you've got stiffness in your neck and there's some cervicogenic dizziness, if you jump in and try to desensitize yourself to a grocery store, you tell the person, go in a store, stay as long as you can, turn your head, do all this stuff, shake your head, follow your finger. It's going to flare you up because your visual system's already super stressed. It's just going to stress it more. The biggest mistake, it's not that those are terrible ideas, but they're at not the right time to do it. You need to control and fix the original issue and then gently, very, very gently start to make your brain more comfortable with the same stimuli that it used to be triggered by. That's my experience, but what would you add to that? I know we've both seen this in its own different kind of way, but
totally. And I think that something different works for everyone, right? But I think that something really important to understand is the ability to calm your body down before you start to do other exercises that you feel like, oh, well, this makes me dizzier. And I hear if you get dizzier, then you get less dizzy over time. And while, yes, that is true, if you go into a grocery store and you make yourself dizzier than your baseline, and then you leave the grocery store and it ruins the rest of your day, week, month with an attack, with another panic, with something like that, and you're not able to calm yourself down, your brain learns to reinforce that behavior that we shouldn't go to the grocery store. So before we go to the grocery store, I'm going to make you dizzy so we don't go in the grocery store in the first place because it made us dizzier last time. And that activity where you go again and again and again and again and again, and it makes you dizzier and dizzier and dizzier and dizzier, isn't going to make you less dizzy over time unless you have the techniques for breathing and for grounding and for calming yourself down. And if you're having a really hard time with this, there are people like amazing therapists, for instance, who absolutely are able to help you with this. We talk a lot about this in vestibular group fit. I talk a lot about this with my one-on-one patients and clients. I'm sure you do the same, because the ability to breathe and to ground and to say, I am safe. Thanks for letting me know, brain, but that's really not helpful. The ability to do that is bar none one of the most important things you can do with dizziness. So that I say is a huge part of my treatment plan always.
It's kind of a don't pass go situation. Like what I always tell people, like it's good to do as much as you can if you feel safe when you do it. That doesn't mean you feel 0 out of 10 symptoms necessarily, but if you're wildly symptomatic, freaking out, panicking, it will not help you. It will make it take longer. It will make
100%, 100% agree.
And that is probably in a nutshell, like the number one issue I see when people are either self-treating or getting information from bad sources or getting unfortunately bad help. That's like the number one thing that's going wrong.
Totally agree. Totally agree.
Well, I know we also wanted to, because people always ask, which I appreciate, but it is difficult. It's like, well, what do I do? You gave me all this information, but what do I do that's better than that, right? It is obviously difficult to do that because, well, we don't know what that person's situation is, but I think we both wanted to give a case example, make sure we give some information, and then give some advice on like, okay, well, what could you do that's better? I wish we could give everyone that kind of advice, but obviously you can't. So this will have to work. yeah, you want to take us through that case example we were kind of writing down, and then we can talk about what we could do to treat it better.
Absolutely. So our case example here is Carrie, who's a 55-year-old female with vestibular neuritis, intense dizziness for 5 days, left with this like kind of chronic floating sensation and neck stiffness. She really likes to play tennis, bake cookies with her family, and she does a lot of computer work on the side of her family stuff. She does have a full-time job, so maybe I shouldn't say on the side, but she said it as on the side. Since her vestibular neuritis onset, she's been really anxious and nervous that it's going to come back again, and feels like she's unable to do any tasks around the house or at work without triggering intense dizziness. And since the dizziness, she's been on the couch usually or in bed, trying to sleep and be still and just kind of make the dizziness go away. She has tried head shaking exercises, VRT on YouTube, a local PT who was not a vestibular specialist. All her testing comes back normal except for her VNG calorics. She had a really mild loss on one of the parts, but is still having so many symptoms, and really is like, what else can I do? Like, is this just forever? And I think that's a really common understanding. And this has been going on for a long time. So 6+ months, and this dizziness is sort of chronic at this point. And activity makes it worse. She definitely is not up for playing tennis, which is one of her favorite things. So what do we do about this?
Yeah. And just to give you everyone feedback on, like, this is an extremely realistic thing. Like, I've talked to well over 100 people this year. Everybody's got different stuff, but like this right here is like probably the most common if I put all those stories together. So just like, it is a very realistic example. So what do we do? Like, what has gone wrong? What needs to happen better? So in my experience, like, when you meet somebody like this, they're overcooking it, basically. Like we talked about, they're doing things that are super stressful, trying to get to visual dependent stuff or VOR stuff that's way too intense. And like you were mentioning, we have to make sure that they are able to feel calm in those situations. They're able to ground. And largely that's around fixing the imbalances. If you have imbalance in your vestibular system in the sense that it's not working well, you have to make sure your body can tune into that. If your neck is stiff and moving abnormally and causing floatiness, you have to correct that. Once you correct those imbalances and the two balance systems that aren't working and how your brain's processing the information from them, you can way more successfully treat the visual symptoms and then kind of go from there back into the higher level stuff. That's a 30,000 foot view of what I would recommend. And it's would be really boring to go through the specifics of hundreds of exercises, but what would you add to that? Like, what do you kind of think about what you would do in a situation like this?
Yeah, I mean, I think you really hit the nail on the head with everything. I think it's so important to remember and to recognize that, like, we need to prioritize the person's, like, their priorities. Is it salient to them? Is it relevant? Right? We're not going to be doing exercises for horseback riding when it's a person who wants to play tennis, right? So making sure it makes sense to them, getting this person back into her day-to-day routine, and really focusing on what I call the basics. So are you sleeping? Are you hydrating? Are you eating throughout the day? There's a couple more. Are you moving your body regularly? Like, all of these things are so important and so basic just to being a human being, like a healthy, however you want to slice it, human being. We need to move our bodies. We need to be eating a whole, really great diet regularly. We need to be doing kind of all of these things every single day, especially sleep. And I always say, if you're not sleeping, nix the rest of it. Just, you need to be sleeping. But I think adding all of that with the basics, with breathing, with mindset, with kind of trying not to be so afraid of the dizziness, which is so much more easily said than it is done. And I want to recognize that, like, sitting here preaching like, oh, just don't be nervous about the dizziness is so easy, but it's so hard to do in practice. This is something I see in my patients and in my group all the time. People are like, how is that even possible? And it does, with practice over time, get easier. But practicing these things on a regular basis is going to be so important.
Yeah. And I think part of it, right, is like, it is easier said than done. But one of the big reasons that it's hard is because people have been given really poor information. Like, it's going to be really impossible to not be super emotionally stressed and devastated by your symptoms if they're at 8, 9s out of 10. Like if you're ramping it up and you can't do basic stuff, take care of yourself, your family, like sleep well, yeah, no one feels good. So like that's part of like why I wanted to kind of have this conversation, is just to encourage people, like that has to be the first step, and understanding what's going on and how to appropriately approach it is gonna save you a lot of emotional trauma from like feeling like crap consistently.
I totally agree. And if your doctor is gaslighting you, telling you're making it up, not giving you information that you feel like is trustworthy, or you're like, you really click with them, please find another provider. And I know it's easier in the States to find another provider than it is in other countries. I 100% understand that. But I really like, this is one of those things that if you're having a provider that you don't really click with, you don't really get along with, you feel like is gaslighting you and giving you bad information, it is typically not 100%, but like 99% of the time going to make things worse. So this is one of the times where you're like, I'm going to invest in seeing someone I trust and really like. And it doesn't have to be me, doesn't have to be Dr. Drew, but someone who you feel like you will like and trust and really get along with is going to be essential for you.
100%, 100%. Well, I'm glad we got to do that. Thanks for taking the time to do that. Any last comments you wanted to make there?
I think just know that it gets better. It really, really gets better. And I have seen people literally who have been struggling with dizziness for 25, 30 years get better. And there are no cures for these things. It's not like you're never, ever, ever going to experience dizziness again. And don't let someone tell you that. It's a huge red flag for any provider, but it does mean you're not going to be dizzy every day for the rest of your life.
Yeah. And I always tell people, like, they ask me, are you ever dizzy? I'm like, I'm dizzy in the sense of when I get a sinus infection, I'm dizzy. When I'm tired, I get floaty, like, but I never let it it's never bothers me to the point where I have to change my life at all at this point. And it used to be an everyday thing where I had to avoid stuff. So like, it's extremely realistic that you can go back to living the life that you want to live. In my experience, 100%. I've seen it literally hundreds plus times. So yeah, I think that's the positive thing, is like, it's not like a death sentence. It's like, you can go back to living the life you want to live, for sure.
Just because your provider doesn't like to treat it doesn't mean it's not treatable.
Yeah, exactly. And then I know from just on your end, like clicking around your website, Dr. Madison has a ton of good information on stuff like this. I just made a new webinar about like this whole process of balance, integrate, grow, talking about how to treat this kind of thing. So I don't know if you have any specific stuff that you would recommend checking out on your website, but
yes, we just redid the website, which I'm really, really excited about. So you're going to purchase a plan that works for you in vestibular group fit, which is less than $60 a month. It is meant to be the most affordable way to manage your dizziness. And it is comprehensive. It is holistic. It is not just another medication prescription. It is going to be all the things you need to manage your dizziness from home in one place at one time. So you're going to purchase a subscription, log in, take a quick quiz, watch a quick video, and all of the things are going to be totally custom to you and your needs, which I'm really excited about. It's going to ask you about anxiety, about neck pain, about your diagnosis, if you have one, if you have more than one, all of these things. And it's going to add together and kind of do a calculation of what you need to watch and in what order. And it will go from there. And I'm really excited for it. So definitely keep an eye out for that and go ahead and join us there.
Sweet, sweet. Well, thanks for taking the time to do this. Hopefully for everybody watching, it was helpful. I mean, that's the big thing with this, is like Madison said, there's nothing you could buy at the end of this call. So it's more those, hopefully about saving you from the common mistakes that I've made and seen. So hopefully it was helpful. And thanks, Madison, for taking the time to do it.
Yeah, sure thing. Thanks.
All right. See you. Bye.